So I am Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I want to welcome all of you to our Doctor's Edition. A little bit about myself. I'm an obstetrician gynecologist. I trained at Wayne State School of Medicine in Detroit, Michigan. I completed my residency here in Chicago at Cook County. It's now called Stroger Hospital. That was a long time ago. I'm the CEO of RGM Wellness and Rip Rita Fitness. I'm a global women's health and wellness speaker. I'm also a certifying physician for the medical marijuana program here in Illinois, as well as the opioid exchange program. I'm a member of Doctors for Cannabis Regulation, as well as the chief medical officer and one of the co-founders here at Wakana. I want to introduce you to our medical advisory board. Our medical advisory board comprises of healthcare professionals who are advocates for the cannabis plant, including not only medical physicians, MDs, but RNs, registered nurses. We have nurse practitioners. We also have other fields in the healthcare industry. We have chiropractors, dentists, as well as pharmacists. We have clinical psychologists. We also have holistic healers. We have naturopaths, aromatherapists, as well as we're really excited about possibly veterinarians that are going to be joining our medical advisory board. So let's talk about cannabis. Let's talk about how is it that cannabis is mainstream. Many of you on the line understand that CBD, once it was legalized in 2018 under the Farm Bill, really has been getting a lot of attention from those who are looking for a holistic, natural, and organic way of addressing their health. Well, Dr. Sanjay Gupta really is the reason for cannabis as a whole becoming mainstream. See, in 2014, he came out and made a public apology. He stated that he didn't dig deep enough. See, Dr. Sanjay Gupta was one of those physicians, like many, that said no to cannabis. He said there was absolutely, in 2009, I think it was, there's absolutely no benefit medicinally that the cannabis plant can offer any patient. He said, in fact, there's a huge safety concern. There's an addiction concern. But it wasn't until Dr. Sanjay Gupta traveled the world. He interviewed experts, not only in the research arena, but with other physicians in Europe that were utilizing cannabis mainstream. And when he figured out that cannabis had been used by hundreds and thousands of people across America, he decided that he wanted to do even deeper research. And he came across a little girl by the name of Charlotte Figi, who has a condition called Derived syndrome. It's a condition where children have between 300 and 500 seizures a week. And the parents of Charlotte Figi actually introduced her to a strain of CBD called, well, they ended up calling it Charlotte's Web, as you know it today. But it wasn't until her parents introduced that to their daughter, this little girl went from having 300 seizures a week to 3 seizures a week. And that is really what caught Dr. Sanjay Gupta's attention. With all the research and all the travel, he came back and made a public apology and said, we have been systematically misled about this plant, that this plant offers healing. This plant has been used for centuries. The research and data has been hidden. And yes, I am now an advocate for utilizing cannabis for medicinal and therapeutic purposes. So when we look at the plant, cannabis sativa, it has 2 species. And this is really important, especially for healthcare professionals on the line. Like I was about 4.5 years ago, the only thing that I knew about cannabis was marijuana. the high that it gave you, the euphoria that it gave you, the paranoia that it gave you, right? But cannabis has another part of the plant, and that species is called hemp. And hemp doesn't give you the high. It doesn't give you the euphoria or paranoia. But what hemp gives you and provides for our patients are the health benefits, in those who have symptoms due to arthritis, like pain and inflammation, or those patients of ours that have autoimmune conditions like lupus and multiple sclerosis, or the patients that we have that are looking for an alternative for their blood pressure, their elevated blood pressure and elevated blood sugar. So it's really another side of the plant that is the reason why you're here tonight, to understand that hemp, because of its makeup of having very low levels of delta-9 THC, and the reason why marijuana gives you that high is because it has high levels of delta-9 THC. Well, the amount of delta-9 THC in hemp is less than 0.3%. So it's so small that it doesn't give you the health. It doesn't give you the high, but it gives you the health without the high. So again, cannabis is the family. The two species is marijuana and hemp, and the difference is in the level of delta-9 THC, marijuana being high and hemp being low. Well, there's some other differences between marijuana and hemp. They both contain CBD, cannabidiol, which we'll be talking about today. But characteristically, marijuana is known for its flowering tops on the plant. They're typically very short and stubby bushes, whereas hemp is very tall and thin and usually grows about 20 feet high. And again, I can't emphasize this enough. Marijuana gives you the high, the psychoactive side effects, whereas hemp has no psychoactive properties at all. So all of our products here at Wakana will not and cannot give you a high. So yes, CBD sourced from the hemp species of cannabis is legal. In 2018, the Farm Bill, which is an agricultural bill, was passed and now legalizes CBD that's sourced from hemp that contains the legal limit of THC, which is 0.3% or less, to be sold, cultivated, and to be consumed in all 50 states. So hemp was removed from being a Schedule I drug. No longer is it a Schedule I drug, and it is legal under the Farm Bill. Now, what's important for you to understand is that though it's legal under the 2018 Farm Bill, the FDA has not approved CBD. They've only approved one medication that is a CBD prescribed medication called Epidiolex. And Epidiolex is the first and only FDA-approved prescription. It's about $3,200, $3,500 a month, and it's used for those kids that have Derived syndrome like Charlotte Fiji had, and tuberous sclerosis and other seizure disorders in children. So it's used in patients 1 year of age and older. There's other medications that are FDA approved. Funny enough, they're THC. They are based from the marijuana plant. Syndrose is one. It's used for nausea and vomiting in cancer patients. It costs about $1,500. There's Marinol, another THC-based product that's FDA approved by prescription only. There's Sesamet is another THC medication, FDA approved. And then there's Sativex, which is a 1-to-1 combination of delta-9 and CBD, only approved in the UK. But just know that millions and millions of people here in America are seeking an alternative to their health. And they're seeking an alternative to their health because many of our patients are on multiple medications. You know, the average 55-year-old is on 7 medications. The average 75-year-old is on about 10 to 12 medications. And they're on so many medications because of side effects. And they're on so many medications because it's so difficult sometimes to treat some of the conditions that we face with our patients with one medication. So here are some of the top reasons that folks are using CBD. They're using it to relax. They're using it to reduce stress and anxiety, to improve their sleep. But the number one reason that folks use CBD is to relieve muscle pain, chronic pain, joint pain. Pain is the number one reason that folks are looking to use and are using CBD. They also use it to treat migraines and to address their skin conditions like psoriasis and eczema and acne, as well as helping to enhance their sexual pleasure. And all walks of life and age groups are using CBD. We see the baby boomers each and every year increasing the percentage of use from 8% to now over 50% of baby boomers. Gen Zs and millennials are also increasing their use of CBD. And the reason being, for millennials and Gen Zs, they understand that there's a product that gives them the same benefit, the same relief than marijuana, which causes a high. So the healthcare professional, yes, it's absolutely imperative that we as physicians, nurses, nurse practitioners, pharmacists, chiropractors, dentists, that we understand how cannabis works in the body. So let's look at some more benefits of CBD. We talked about some. CBD is an antibacterial. It inhibits cancer cell growth. It's neuroprotective. It helps to regenerate those nerves that have been damaged due to stroke or due to chronic conditions like diabetes. It helps to reduce inflammation and pain and reduce nausea and vomiting. It helps relieve anxiety. It's a vasorelaxant, so it can help improve blood flow to the heart. It can improve blood flow to other important organs like the brain and the kidneys and the pancreas. But there's other cannabinoids, there's other compounds that the plant makes that work synergistically with CBD so that on a cellular level, we're getting the relief that we're looking for. So when we're looking at CBG and CBC and Delta-9 THC and Delta-8 THC, THCV, all of these cannabinoids are important to work on a synergistic cellular level to enhance the results that we're looking for. And that's called a full spectrum product. So the plant makes cannabinoids, and we talked about many of them in that last slide. They're called phytocannabinoids from the plant, but our body also produces cannabinoids. They're called endocannabinoids. So they're endogenously produced by the body. And two main endocannabinoids are anandamide and 2-AG. And they're very analogous to CBD and THC. So they also help to bring balance. They help to bring homeostasis. They are found in high levels of breast milk. That's why breastfed babies are so happy. They're found in high levels of beer hops and dark chocolate. And the way that cannabis works in the body is also important as healthcare providers, that we understand that there is a science behind how it works. The science is called the endocannabinoid system. This is a system we all possess. Every single human being, every vertebrae has an endocannabinoid system made up of receptors that when we consume cannabis, they bind to these receptors. The main receptors are CB1 and CB2. And when they send a signal to different organs and glands, like the brain, the liver, the lungs, the skin, the kidneys, the pancreas, the uterus, the ovaries, the testes, the teeth, the hair follicle, when they send a signal, once we've consumed CBD, The whole purpose of the endocannabinoid system is to maintain balance, to bring the body back in balance so that those who are suffering from insomnia or anxiety or depression or hair loss or diabetes or hypertension, consuming CBD, consuming cannabinoids, consuming cannabis can help assist with these symptoms to put the body back in balance. So there's a science. It's not a snake oil. It's not a magical potion. There is a real science, and only less than 8% of medical schools are teaching their medical students about the endocannabinoid system. So there are some interactions where CBD can potentially interact with medications that our patients may be on. The interactions can be to reduce or inhibit the medication that they may be on, or it could potentiate or increase the way that this medication is working if they're consuming CBD. And the way that the metabolism acts is through the CYP450 pathway that we all learned in school. And this pathway is utilizing the liver to break down many medications. It breaks down CBD as well. But the two medications that really healthcare professionals should know about and its interaction with CBD is warfarin or Coumadin, that's a blood thinner, as you know, and theophylline, which is, yes, an old medication that we used to use a lot for asthma, but still it can reduce or it can potentiate the way that these pharmaceutical medications work. So when a patient is wanting to utilize CBD, it's good to monitor the INRs if they're on Coumadin a little bit more closely, monitor the theophylline levels if they're on theophylline. It doesn't mean that our patient can't take CBD. It just means that there may be some more additional monitoring that needs to take place. Now, another concern with our patients is drug screening. Will CBD show up on my drug tests? Now, drug testing today by most employers are point of care, and we'll talk about how you really want to utilize a more sensitive and specific urine drug screen that LabCorp offers so that you can tell the difference if a patient or an employee is taking CBD or if they're indulging in marijuana. So there's been lots of studies that look at how CBD can be detected if it's used topically. Now, topical use of CBD will not pass the blood-brain barrier, and it will not cause the urine drug screen to be positive. There are some other studies that show that you would really need large doses, dosing between 1,000 and 2,000 milligrams of CBD daily, a full spectrum product that has a legal limit of THC, to have 11 to 23% chance of detecting in a urine drug screen. And that's a lot of CBD. Most people don't need more than 50 to maybe 200 milligrams on a high end of CBD a day on a daily dose. 1,000 to 2,000 milligrams is a large amount, but needless to say, if you have a patient that has random drug screens at their job, the best way is to offer them a broad spectrum product that contains less than 0.0% of THC. Now, when we talk about drug screening, again, LabCorp has a very sensitive and specific urine drug screen that you want to ensure that your patient is asking their employer to utilize, because the point of care drug screenings, the ones we find at Walgreens and CVS, they're not very sensitive or specific. And typically, no matter what they're using, if it's an isolate of CBD or broad spectrum of CBD, it will become positive because the drug screen is not very smart to detect if it's THC or CBD or if it's hemp or marijuana. So you want to utilize LabCorp, which does a CBD to THC ratio. It's a great test for those who want to use CBD and may have random drug screens. So there's 5 things to know before buying a hemp-derived CBD oil product. And that is 1, partnering with Wakana. We have products that you can trust, products that are tested, products that have a certificate of analysis, products that undergo third-party testing, products that are extracted with a very clean extraction method from the biomass or the plant called a supercritical CO2 extraction process, ensuring that the hemp is being grown organically because hemp is a bioaccumulator. So whatever is in the soil, it can accumulate in the product. So these are important things that you as healthcare professionals should know and want to ensure that your clients, your patients, are utilizing Wakana products. So our products are extracted with a supercritical CO2 extraction method. It's the cleanest method. There's other extraction methods like butane and propane. Those methods are less expensive and more harmful on the environment and don't produce a very clean product like supercritical CO2. Now, there's so many ways of consuming CBD. Your patient may ask, well, should I use it topically? Should I use it as a tincture? Should I eat the gummies? Should I swallow the pills? Should I use the smokable, the vape cartridges, or the pre-rolls? Well, the answer is you want to utilize many ways of metabolizing and consuming CBD because each and every way of consuming CBD has a different duration and has a different onset of action. So as one product, like our smokables, act within 1 to 5 minutes, yes, it's quick on onset of action, but the duration is short. Within 1 to 2 hours, that smokable is leaving your bloodstream. Whereas the tincture takes 20 to 30 minutes to get into the bloodstream, yet its duration is 6 to 8 hours. Though the topical is pretty immediate onset of action as you rub the topical on, again, the duration is 2 to 3 hours. So you understand the importance of layering these products and different routes of consuming, because as one is kicking in and the one that has a shorter duration is wearing off, you can always keep a steady state of CBD in the bloodstream by utilizing different forms. So when we look at the research, you want to look at PubMed. PubMed has a lot of articles that truly really help us as practitioners understand how cannabinoids work in different areas, in difficult to treat pain, in anxiety disorders, in cancer treatment, those who are undergoing chemotherapy and radiation, in GI disorders like ulcerative colitis and Crohn's disease and reflux, as well as many top universities like UC San Diego, University of California in San Diego. They're doing a lot of research on eating disorders, attention deficit disorder, seizure disorders, a lot of research now that the 2018 Farm Bill has been passed and hemp is legal. You're going to see a lot of top-notch universities doing research. So now I want to talk about some of our products. I know as healthcare professionals, you're wondering what sort of products we offer here at Wakana. Our FDA disclaimer is coming up soon, but now I want to talk about our certificate of analysis, which you'll find on every single one of our products. Our certificate of analysis is not mandated by the FDA. The FDA has not made their mandate that CBD companies do this. So that's why you want to partner with Wakana, because if your patient goes out to the gas station or the smoke shop and gets some random CBD product that's not been tested and hasn't been grown organically and it's not been extracted by a very clean method, that particular product could make your patient ill. So this is why it's so critical, especially in this day and age, that you partner with Wakana and partner with products that have been tested and products that have certificates of analysis that really help your consumer, your patients understand that, one, the THC level is in the normal range. The potency is what is on the bottle, is what's in the bottle, and that the product is free from mold, mildew, heavy metals, and pesticides. All of that is spelled out in our certificate of analysis. So we offer all of these forms of consuming CBD. We have smokables, we have tinctures, we have edibles, we have topicals, we have products for hair care, we have products for sexual health. We also offer essential oils as well as products that can help to keep your office and home sanitized. So here's the disclaimer I was looking for. Now, the FDA mandates that we read this disclaimer, that the statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information from healthcare practitioners. Please consult your healthcare professional, which is you on the line, about potential interactions or other possible complications before using any products. The Federal Food, Drug, and Cosmetic Act requires this notice. So we offer a line of tinctures. Tinctures are oils that you place underneath the tongue, and we have two different product lines. We have a power line, which is our full spectrum line, utilizing the legal limit of THC, which is 0.3% or less. And then we have that's our power line. And then our pure line is our broad spectrum. That is the line for those patients who have random drug screens that want to utilize CBD in a safe and effective manner. Now, our Power Hempranium is 500 milligrams of CBD in a 15 ml bottle. We recommend that you utilize CBD by starting low and slow, slow and low, low and slow. You don't need a lot of CBD to address the symptoms that you're looking to address. 3 drops twice a day is great. 3 drops in the morning, 3 drops in the evening will give you around 10 to 12 milligrams of CBD. Now, our pure is 300 milligrams of CBD. Again, 3 drops in the morning, 3 drops in the evening. Twice a day dosing is a great way to utilize CBD. Our Power Water Soluble is 500 milligrams of CBD. Power Water Soluble is a product that you utilize in your water, your juice, your tea, your smoothie. Oil and water don't mix, so we have a product that we utilize for those who want to use it in their cocktails, their mocktails, whatever is liquid, you can put the Power Water Soluble. That is also 500 milligrams in a 15 ml bottle. Use 3 drops in the morning and 3 drops in the evening. Our Hemp MD, that is our therapeutic, our more potent product tincture. It is 900 milligrams in a 15 ml bottle. It's really for those patients who have more severe, who have more challenges going on in their life, but still 3 drops in the morning, 3 drops in the evening is a great starting dose. We have another tincture called Hempowered Hair. It's for those who have issues with thinning, with hair loss, alopecia. It is a product that can be utilized if that patient has issues with hair loss or hair thinning and has random drug screens. Utilize it in a topical fashion. So these are our line of tincture. Many benefits because our products have a proprietary formula. Our products are very unique. Not like any other CBD product on the marketplace. Our products, like our Hempranium 500 milligram, is infused with black seed, with turmeric, with MCT and hemp seed oil as our carrier oil. Lots of benefits to black seed. Studies, in fact, show that black seed oil can help rebuild the beta cells of the pancreas. Turmeric and its anti-inflammatory properties, its healthy heart benefits. It enhances emotional well-being and improves memory. Our topicals offer local relief to those sore, achy muscles and joints. Our Extreme Power Pain Cream is our #1 topical seller. Our Dr. Rita's Rub, again, is another topical in a liquid format. Our body butters, our body creams, our serum for the face, our body cream, our Power Mango, as well as our oud oil are just really amazing topical products for the skin and topical products that can be utilized to reduce symptoms due to arthritis, sciatica, and neuropathy. Our edibles include our Flat Belly Brew, as well as our, it's my dog, Hannah, as well as our Flat Belly Brew, as well as our gummies. Our gummies are infused, they're not coated, all with CBD. We have Power as well as broad spectrum gummies, so that patient who wants to utilize our gummies and has random drug screens will use the pure gummies. Our Power gummies offer, again, the legal limit of THC. We have gummies that enhance our sexual patients that have low libido or have issues with stamina or erectile dysfunction. And then we have our Delta 8 gummies for those who want more creativity, those who need more potency, that offer that Delta 8 gummy as well. We have a whole line of products that detox. Our bitter tea, though they don't include CBD, but the detoxification of the colon and the liver, that's so important, as well as our immune defense tea. Just a lot of great products. Our essential oils, again, the black seed oil benefits the pancreas. The black seed oil is something that I offer patients who are diabetic along with the tincture, because black seed helps to rebuild the beta cells in the pancreas. Lots of research you'll find regarding that. Our First Defense is a nasal spray that utilizes CBD and essential oils to address viral and bacterial loads that can enter through the nasal passageway. All of our essential oils are organic, and all of our essential oils are very concentrated. So you only need a drop when you're utilizing the oils. Our smokable products, our CBD pre-rolls, our CBD vapes. We also offer Delta 8 pre-rolls, as well as our premium flower. These are products that act within 1 to 5 minutes. They can get into the bloodstream to really offer our patients relief from acute situations, an acute onset of migraines or an acute onset of inflammatory pain due to gout. Smokables work fast. Our culinary products are for those who want to spice up their recipes. So we offer garlic fire, Flavor King, and chili lime spices. We offer a vegan butter, as well as a Culinary Plus tincture that can be utilized when you're baking and when you're cooking. Our Save Our Strands hair system utilizes CBD in a renewing shampoo, moisturizing conditioner, leave-in detangler, a styling cream, and even the beard and scalp oil, as well as our hemp-powered hair. We understand that hair loss is a global pandemic. Men, women, and children are losing their hair. They're losing their hair for many reasons. They're losing their hair due to traction from hairstyles. They're losing their hair due to poor diet. They're losing their hair due to comorbidities like lupus, They're losing their hair due to infections like COVID-19. So our system is a system that we can offer utilizing CBD to help reduce inflammation, to help reduce bacteria, and to maintain and to gain a healthy scalp so the hair follicle can nourish and grow. Our sanitizers are hand and surface cleaner. Our Royal Defense is our sister company where we have products that not only keep our home and our office clean and sanitized, but our foods. We have a produce wash that you can utilize on your produce, you can utilize on your meats, on your fish, as well as a travel kit utilizing mask and hand sanitizers. Our sexual health is another system that really provides those patients who are having issues with libido, they're having issues with erectile dysfunction, they're having issues with vaginal dryness. The CBD lube helps to enhance the vagina in those postmenopausal women, in those women that have vaginal atrophy. Our King of the Jungle, our gummies that can be utilized by men or women to enhance the sexual encounter, as well as our body butters. The recommended use on all of our products are located on the bottle as well as our website. Again, starting your patient low, starting them slow is a great way. If you start with too much CBD, it can cause side effects like nausea. It can cause some vomiting. It can cause a headache. It can cause extreme fatigue. So starting low and starting slow helps to reduce those annoying side effects. So again, when we look at diabetes, when we look at a lot of comorbidity, we can absolutely help to assist with our patients who are looking for alternatives for their health. You know, utilizing CBD in the practice can help to reduce that metformin, that can help reduce that amount of insulin, help reduce a lot of the medications that we're using, even with cholesterol, helping to reduce those statins that we're having to use in our patients. So you can't go wrong. There's so many great choices here at Wakana for your patients and for yourself and for your family members. So I'm going to share my email address. I think it's really important if you're a healthcare professional, even if you're not a healthcare professional, reach out to me if you have questions about dosing, you have questions about our product line, you have questions about the science. My email is ritamd@wakana.com. That's ritamd@wakana.com. I would also love to invite you to our overview. My colleague, Dr. Joyce Smith, she is a pharmacist, a lead pharmacist at Stroger Hospital. She will be doing the 8 o'clock call. She'll be going over some of our newer products as well as our existing products. She will go over about the opportunity, because there's an opportunity for you to improve the bottom line at your office. Maybe you want to bring in more revenue by offering our products. Here at Wakana, we also have a bulk order system. So if you want to order in larger quantity to reduce or to increase the profit margin, you can do that as well. But join the 8 o'clock call. The Zoom ID and passcode is located there. You can screenshot. I want to also encourage you to connect with the person that invited you on the call. Whoever invited you on the call, they can answer more of your questions. I'm going to take some questions now. They can get your products ordered. They can really help to steer you in the right direction, especially if you are a healthcare professional. And if you're not a healthcare professional, they can do the same. Any guests, please continue to reach out to the person that invited you so that you can get your products ordered and your questions answered. So I'm going to take a couple of questions in the chat. If you have any questions, you can put it in the chat. and I will take about 5 minutes to answer your questions. If not, we will see you in 15 minutes on the 8 o'clock business overview with Dr. Joy Smith. Well, at this time, I want to thank our guests. I want to thank our business partners. Thank you for showing up each and every Tuesday at 7. Would love for you to invite your healthcare professional on the call, whoever that is. It could be a nurse practitioner, could be your physician, your pharmacist, your dentist, your chiropractor, uh, any healthcare professional, your veterinarian, if you have pets. Invite them every Wednesday or every Tuesday at 7 p.m. We look forward to seeing you next week. Be well, be safe, and join us tomorrow as we celebrate our 3rd-year anniversary on 420. Excited about that as well tomorrow. So tomorrow night will not be an 8 o'clock call because we will be having our festivities at the dispensary. Have a good night, and I'll see you soon.